Good morning, students. I'm Dr. Swathika, Assistant Professor Biochemistry, Sri Lakshminarayana Institute of Medical Sciences, Pondicherry. So today we will be discussing about lipid chemistry. So we'll see what is a lipid. How do you define lipids? So lipids are compounds which are relatively insoluble in water, but freely soluble in non-polar organic solvents like benzene, chloroform, ether, alcohol, and acetone. So they are mostly insoluble in water, or rather hydrophobic. Okay. So what are the basic functions of lipids in our human body? So lipids are the storage form of energy in the form of triglycerides. So lipids store energy as triglycerides. It is a structural component of biomembranes. It makes the component of cellular membrane, cell membrane or plasma membrane by acting as a phospholipid and cholesterol. They also serve as metabolic regulators as steroid hormones and prostaglandins. You know, prostaglandins are some of the lipid molecules which can act in a paracrine fashion. Similarly, steroid hormones also play a role in metabolism by regulating certain functions. Lipids can also act as surfactants, detergents, and emulsifying agents in our body by way of acting as an amphipathic lipid. And also, it can act as electric insulators to neurons. Sometimes lipids which are present in the subcutaneous layer of our skin can provide insulation against external temperature, and they also give shape and contour to the body. These lipids also protects internal organs by acting as a pad of fat, by providing a cushioning effect. And lipids also helps in vitamin A, D, E, and K absorption. These are the fat-soluble vitamins, and they require lipids for its absorption. Lipids also improve taste and palatability of food. This is not in human body. General functions of lipids is it improves the taste and palatability of food. What are the clinical significance of lipids is what we are going to read now. Sometimes excessive fat deposits in our body can cause obesity. And you all know that truncal obesity is a major and individual risk factor for heart attack, or rather myocardial infarction. Abnormality in cholesterol and lipid metabolism can lead to atherosclerosis and cardiovascular diseases. In diabetes mellitus, metabolism of fatty acids and lipoproteins are deranged, sometimes leading to one of the acute complication of diabetes mellitus, which is ketosis. So now we'll be reading about lipids classification. That is how you classify lipids. Okay. So first, basically lipids are classified into simple lipids, compound lipids, derived lipids, and lipids complex to other compounds. Simple lipids are esters of fatty acids with glycerol or some higher alcohols. So example for simple lipids are triglycerides, neutral fats, and waxes. Triglycerides or triacylglycerol or triglycerides or neutral fats and waxes. Compound lipids, that is lipids which has an additional functional group in it. Derived lipids includes fatty acids, steroids, prostaglandins, leukotrienes. And the fourth category is lipids complex to other components or other compounds like protein plus lipid will give proteolipids and lipoproteins. So now we'll see what are the lipids which will be coming under compound lipids. So phospholipids, which contains phosphoric acid, will come under compound lipids, as well as some nitrogen containing glycerophosphatides, non-nitrogen glycerophosphatides. All these will come under compound lipids. So what are the phospholipids which contains phosphoric acid are? It can be again classified into nitrogen containing glycerophosphatides, non-nitrogen containing glycerophosphatides, plasmalogens, and phosphosphingosides. So we'll see the subcategory under the main category, phospholipids containing phosphoric acid. So the first one is nitrogen containing glycerophosphatides, which will include lecithin, which is also called as phosphatidylcholine, cephalin, which is also called as phosphatidylethanolamin. Third is phosphatidylserine. Non-nitrogen glycerophosphatides are phosphatidylinositol, phosphatidylglycerol, diphosphatidylglycerol, which is also called as cardiolipin. The third subdivision or subcategory under phospholipids containing phosphoric acid is plasmalogens. Plasmalogens basically have a long chain alcohol in its chemical structure. So the examples include choline plasmalogen and ethanolamine plasmalogen. The fourth subcategory is phosphosphingosides, which will contain the sphingosine as a backbone. So the example for this phosphosphingoside is sphingomyelin. So I repeat, so we are classifying the lipids as simple lipids, compound lipids, derived lipids, and lipids complex to other compounds, in which we are going to see the examples or how compound lipids are subclassified. So compound lipids, the first category will be phospholipids containing phosphoric acid, which is divided into all these four subcategories. Next is non-phosphorylated lipids, which includes both glycosphingolipids and sulfolipids. Glycosphingolipids are subclassified into cerebrosides, globosides, and gangliosides. Cerebrosides are nothing but ceramide monohexosides. Globosides are ceramide oligosaccharides. Gangliosides are ceramide plus oligosaccharide. In addition to it, we'll have N-acetyl neuraminic acid. The second non-phosphorylated lipids is sulfolipids, which will include sulfated cerebrosides, sulfated globosides, and sulfated gangliosides. Now we'll see what is a fatty acid. Fatty acid is the most component lipid present in our body, and it will belong to the category of derived lipid. It is nothing but an aliphatic carboxylic acid with this RCOOH group. So this carboxylic acid will form the functional group, and this R will contribute to the hydrocarbon chain of that lipid component. So how fatty acids are classified? So it can be classified depending upon the number of carbon atoms. Even chain, which are present in naturally occurring fatty acids, and odd chain fatty acids are present in microbial cell wall and milk. And it can also be classified. The fatty acids can also be classified based on the length of the hydrocarbon chain into short chain, medium chain, long chain, and very long chain. Short chain will contain 2 to 6 carbon atoms. Medium chain will contain 8 to 10, 12 carbon atoms. Long chain will contain 16 to 22 carbon atoms, and very long chain will contain more than 24 carbon atoms. And fatty acids can also be classified based on the nature of the hydrocarbon chain. It can be classified into saturated fatty acids, unsaturated fatty acids, branched chain fatty acids, and hydroxy fatty acids. So what are the characteristics of fatty acids? That is what we are going to read now. So like based on number of carbon atoms, chemical nature, and where it is present, in which component it is, food component it is present, we are characterizing the fatty acids. So acetic acid, which has got 2 carbon atoms. So this is the table which is showing you the even chain saturated fatty acids, in which you have acetic, butyric, caproic, and capric. So acetic acid has 2 carbon atoms, and it is a saturated small chain fatty acids which is present in vinegar. Butyric acid has got 4 carbon atoms, which is also a saturated small chain fatty acids present in butter. Caproic, 6 carbon atom present in butter, and is a saturated small chain fatty acids. Capric has 10 carbon atom, which is a saturated small chain fatty acids present in coconut oil. Next is lauric acid, which has 12 carbon atoms, and it is also a saturated small chain present in coconut oil. Myristic acid, 14 carbon atom, which is also a saturated small chain fatty acids present in coconut oil. Next is palmitic acid, which has 16 carbon atom, which belongs to saturated long chain fatty acids, which is actually present in our human body fat. So basically body fat. Stearic acid, which has 18 carbon atom, also belongs to the category of saturated long chain, which is also present in body fat. Arachidic acid, which has 20 carbon atom, which is also a saturated long chain present in peanut oil. So now already we have seen the characteristics of even chain saturated fatty acids. Now we'll see the odd chain saturated fatty acid, which is nothing but the propionic acid, which has 3 carbon atom, which is a saturated odd chain, which plays a role in the lipid metabolism. Next is even chain unsaturated fatty acids, which includes palmitoleic acid, oleic acid, and erucic acid, which will be belonging to the mono unsaturated fatty acid category. So palmitoleic acid has 16 carbon atom, which is a MUFA, mono unsaturated fatty acid, present in body fat. Oleic acid is a 18 carbon atom, which is also a mono unsaturated fatty acid, present in body fat. Next is erucic acid. Erucic acid is a 22 carbon atom monounsaturated fatty acid present in mustard oil. And again, same unsaturated fatty acids, which are polyunsaturated fatty acid, includes nervonic, linoleic, linolenic, and arachidonic acid. So nervonic is got 24 carbon atom, which is a PUFA present in brain lipids. Linoleic has got 18 carbon atom, which is also a PUFA present in vegetable oils. Linolenic, again 18, arachidonic 20 carbon atom, polyunsaturated fatty acids, both are present in vegetable oils. Next is a timnodonic acid, which has 20 carbon atom. By chemical nature, it is an eicosapentaenoic acid present in fish oils and brains. Clopidonic acid, which is a 22 carbon atom, which is a docosapentaenoic acid present in fish oils and brains. And cervonic, which has 22 carbon atom, which is also a docosapentaenoic acid present in fish oils and brain. Next is, we are going to read about the characteristics of branch chain fatty acids, which includes isovaleric acid, which has 5 carbon atoms, and it is a branch chain fatty acid, which plays a role in the lipid metabolism. Next is hydroxy fatty acids, which includes cerebronic acid with a 24 carbon atom, and it also is present in brain lipids. So what is a saturated fatty acid? So the basic chemical nature of saturated fatty acid will not contain double bond. The general formula is CH3, CH2N. So this N will determine number of hydrocarbon atoms, and with the functional group, that is carboxylic acid group, COOH. So acetic acid, which acts as a metabolic intermediate, has a basic formula of CH3COOH. Butyric acid, CH3, CH2, COOH. So it is a 4 carbon atom, 4 carbon fatty acid. It also acts as a metabolic intermediate. Palmitic acid has got a formula of CH3, CH2, 14, and COOH present in body fat. And stearic acid is also a 16 carbon atom, 16 carbon in between the methyl group as well as the carboxylic acid group, which is also present in abundant in body fat. So how are the saturated fatty acids named? They are named by adding a suffix enoic after the hydrocarbon atom. So human body will contain 50% oleic acid, 25% palmitic acid, 10% linoleic acid, and 5% stearic acid. So you can see a hydrocarbon chain linked a fatty acid structure. So we'll be seeing how it is named. So based on the carbon atom numbering, the carbon atom which contributes to the functional group, COOH group, will be the first carbon atom. Next to it, we'll start numbering from the first carbon atom, which is the carboxylic acid carbon atom. So 1, 2, 3, 4, 5. The methyl group will be the 6th carbon atom in this structure. So when you are going to label from the methyl group, you label it as, you name it as omega 1 here. The methyl group will be named as omega 1, subsequently omega 2, 3, 4, and 5. That is how you label from the methyl group side. From the carboxylic side, you label it as 1, 2, 3, 4. Unsaturated fatty acids are named by adding the suffix enoic after hydrocarbon. You have to be careful. Here it is enoic, here it is enoic. And they will contain double bond. Unsaturated fatty acids will be having double bond, and they will be exhibiting geometrical isomerism around the double bond. And these are the naturally occurring fatty acids. Mainly, all the naturally occurring fatty acids will have cis configuration. And the unsaturated fatty acids which are participating in the body metabolism will be having trans configuration. What is a polyunsaturated fatty acids? Polyunsaturated fatty acid is nothing but unsaturated fatty acid with more than or equal to 2 double bonds. And they also exist in cis configuration in naturally occurring lipids. Example include linolenic and linolenic acids, which are the polyunsaturated fatty acids, also the essential fatty acids, which has to be supplied through the diet, which cannot be synthesized easily by our human body. So of which omega-3 family includes linolenic acid, omega-6 family includes linoleic acid and arachidonic acid, and omega-9 family includes oleic acid. So you can see the structure of linoleic, linolenic and arachidonic. It is linoleic has 18 carbon atom and the 2 double bonds are present at the 9th and 12th position when you start counting from the carboxylic acid side. Okay, so when you start counting from this side, at the omega-6 it has got the first double bond. That is why they belong to omega-6 family. Similarly, arachidonic acid, which is a 20 carbon atom fatty acid, has got 4 double bonds. When you start looking at the double bond location from the carboxylic acid side, it will be in the 5, 8, 11 and 14. When you count from this side, from the methyl group, it will be in the omega-6th position, like from 20th here, if you count it, in the 6th position. That is why they also belong to omega-6 family. Linolenic is a 18 carbon atom with 3 double bonds present at the location 9, 12 and 15 when you're counting from the carboxylic acid side, belong to the omega-3 family. Polyunsaturated fatty acids, in which arachidonic acid is actually a non-essential fatty acid, so it can be synthesized in our body. And these arachidonic acid serves as a precursor of prostaglandins. Next is pentanoic acid, which also belongs to omega-3 family, which is present in fish oils, and icosanoids, which are derived from the 20 carbon arachidonic acid. These are polyenoic unsaturated fatty acids, and they include certain chemical mediators called prostanoids and leukotrienes. Prostanoids includes prostaglandins, prostacyclins, and thromboxanes. These are the icosanoids, which are actually derived from the 20 carbon arachidonic acid present in our body. Omega-3 fatty acid benefits. What are the benefits of omega-3 fatty acids are? They help in infant development, and also they have a protective role in cancer as well as preventing cardiovascular diseases. And they can also be used to treat mental illnesses like depression, ADHD, and dementia. And they have a pleiotropic effect against inflammation, platelet aggregation, hypertension, and hyperlipidemia. And they also mediate alterations in cell membrane composition and function, thereby playing a role in gene expression as well in icosanoid production. These are the benefits of omega-3 fatty acids. What is a trans fatty acid? Trans fatty acids are present mainly as dairy products and also in hydrogenated edible oils. These are actually injurious to health. These are the fatty acids which are added to the products to increase the shelf life of fried food. So oils containing polyunsaturated fatty acids also will have a high content of trans fatty acids. So it is not meant that PUFA is strictly healthy. It also has high content of trans fatty acids, which is actually basically injurious to our health. So all the fast food preparations will have a high TFA content. So these trans fatty acids will adversely affect the plasma lipids and lipoproteins. They also promote systemic inflammation, endothelial dysfunction, insulin resistance, and ultimately lead to diabetes and adiposity. So it is basically high in processed foods and bakery products, where partially hydrogenated vegetable oils will be used for cooking. So this is a table showing the composition of oils and fats in so many of dietary products. So in coconut oil, the saturated fatty acids is 86% and MUFA is 12 and PUFA is 2. So if you see this list, Coconut oil as well as mustard oil has got higher degree of higher percentage of saturated fatty acids, and the saturated fatty acid present in coconut oil are medium chain fatty acids, and those which is present in mustard oil contains erucic acid. Similarly, in this list, if you can see, which has got higher content of polyunsaturated fatty acids, you can see it is safflower oil, and next comes your sunflower oil, and then corn oil. So these are the oils which will have more of polyunsaturated fatty acid in this list provided. What are the properties of fatty acids? One is hydrogenation. So unsaturated fatty acids may be converted to the corresponding saturated fatty acids by hydrogenation of the double bond. So if you see linoleic acid, if you are adding two hydrogen atoms to the linoleic acid, it becomes linoleic acid. And if you add two more hydrogen to linoleic acid, it becomes oleic acid. And if you add two more hydrogen, it will become stearic acid. So it will ultimately unsaturated fatty acids upon hydrogenation, it will ultimately become saturated fatty acid. So there will be hydrogenation of the double bond. So hydrogenation of oils can lead to solidification and saturation. Example is vanaspati. Next property is halogenation. When you are treating fatty acids with halogens under mild conditions, they can take up halogen atoms at their double bonds to form halogenated derivative of the fatty acid. For example, if you're treating oleic acid with iodine, it will become diiodo-oleic acid. So number of halogen atoms taken up will depend upon the number of double bonds and is an index of degree of unsaturation. Next property is melting point. The short and medium chain fatty acids are liquids, whereas the long chain fatty acids are solids at 25 degrees Celsius. The solubility in water decreases while melting and boiling point increases with increase in chain length. So if there is chain length is more, solubility will decrease and melting and boiling point will increase. Fourth property of fatty acid is salt formation. Saturated and unsaturated fatty acids will form salts with alkali. So if you see acetic acid when treated with sodium hydroxide, it will form sodium acetate and water. Sodium and potassium salts of long chain fatty acids are called as soaps. Calcium and magnesium soaps are insoluble, and these calcium soaps can be used in grease. This alkyl sulfate and alkyl sulfonate are not precipitated by hard water. These are the salts and can be used as detergents. Fifth property of fatty acid is ester formation. Both saturated and unsaturated fatty acids form esters with alcohols, especially with glycerol. So fatty acids can form mono, di, or triesters with alcohol groups of glycerol. Triglycerides or triacyl glycerols are also known as neutral fat. So when a fatty acid is esterified with a single fatty acid is esterified with single glycerol, it will form a compound called monoacyl glycerol. Similarly, a monoacyl glycerol, when it is esterified with one more fatty acid, it will form diacyl glycerol. A diacyl glycerol is esterified with one more fatty acid, it will form triacyl glycerol or triglycerides. Next, sixth property is oxidation of fatty acids. All fatty acids will undergo oxidation in our body to give energy. So beta oxidation is the major process by which these fatty acids are oxidized. Unsaturated fatty acids can also undergo auto-oxidation due to the presence of highly reactive double bonds and a variety of products. Next, we'll see what is a glycerol. So, glycerol is a trihydric alcohol which has got 3 hydroxyl groups in it. And it is synthesized in our body from glucose. So, it combines with 3 molecules of nitric acid to form trinitroglycerin, which acts as a vasodilator. So, this trinitroglycerin can be used in MA patients sublingually to immediately provide relief. So, sublingual absorption is more, which will lead to vasodilation of the spastic coronary vessels and relieving the pain immediately. And this glycerol can be esterified with fatty acid to form monoacyl glycerol or monoglyceride, diacyl glycerol, as well as triacyl glycerol. And the nutritive value of the glycerol is it can be converted to glucose and it can also be incorporated in the phospholipid structure. So you can see the structure of triacyl glycerol here, which has got alpha, beta, and alpha. It is named as that. What is a neutral fat or triacyl glycerol or triglyceride? It is esters of trihydric alcohol with 3 fatty acids. So these are basically uncharged. It has got no ionizable group in it and they are very abundant in nature. It will constitute 98% of lipids present in adipose tissue, 30% in plasma or liver, and less than 10% in RBC. So this triglycerol constitutes 98% of lipids in adipose tissue, 30% in plasma or liver lipids, and less than 10% in RBC. It can be a simple triacyl glycerol, which has the same fatty acid esterified with glycerol in all the three, or mixed triacyl glycerol, which is different fatty acids are esterified with glycerol. So triacyl glycerol are the storage form of lipids, which can be used as an energy source when stored in the adipose tissue. And this digestion of dietary fat and mobilization of triacyl glycerol from adipose tissue happens by this pathway. You can see which is projected down. So triacyl glycerol will be acted upon by an enzyme called lipase, which will cleave one fatty acid from triglyceride and produce diacyl glycerol. Similarly, it is subjected to the enzymatic action of lipase, which will result in production of monoacyl glycerol. And this monoacyl glycerol, when it is undergoing lipolysis, it will result in free fatty acid production as well as free glycerol. What are the physical properties of triacyl glycerol? It is hydrophobic. So basically it belongs to lipids. So it is hydrophobic and insoluble in water. So melting point of triacyl glycerol will increase as the number of carbon atom in its hydrocarbon chain increases. And also as the number of double bond decreases, melting point will increase. So melting point is directly proportional to number of carbon atom in the hydrocarbon chain and inversely proportional to the number of double bonds. Triglycerides rich in unsaturated fatty acids are generally liquid at room. So they are called as oils. Triglycerides which are rich in saturated fatty acids are generally semi-solids or solids at room temperature. So they are called as fats. What are the chemical properties of triacyl glycerol? So they'll have a typical ester and alkene chemical properties as they are composed of these two groups. That is saponification, replace the hydrogen atom with salt from a strong base. Hydrolysis, it produces the fatty acids and glycerol, a reverse of formation of triacyl glycerol. Next is hydrogenation, which will result in saturation of double bond. So triglyceride reactions, the three basic reactions which are undergone by the triglyceride are, one is glycerol plus fatty acid leading to triacyl glycerol formation, then saponification, then saturation of triglycerides. Saponification. So saponification number is defined as the number of milligrams of potassium hydroxide required to saponify 1 gram of fat. It is an indication of molecular weight of the fat and is inversely proportional to it. So higher the molecular weight, lower the saponification number. So you can see it produces salt. It replaces hydrogen with a salt from a strong base. Next is iodine number. Iodine number of a fat is defined as the number of grams of iodine taken up by 100 grams of fat. It is an index of degree of unsaturation and is directly proportional to the content of the unsaturated fatty acid. Next is rancidity. You know what is rancidity, right? Some disgusting smell which develops when you're keeping the cooked oil for a longer time in a closed container. The same. It is an appearance of an unpleasant smell and taste for the fats and oils. It can be of two types. One is called as hydrolytic rancidity. Other one is called as oxidative rancidity. Hydrolytic rancidity will cause partial hydrolysis of triacyl glycerol due to traces of hydrolytic enzymes present in the naturally occurring fats and oils. Oxidative rancidity is the partial oxidation of unsaturated fatty acids will result in formation of epoxides and peroxide, which will affect the integrity of the biomembrane, leading to cell death. Now we'll see what is a phospholipid. So if one of the fatty acid chain in a triglyceride is replaced with a phosphate group, a phospholipid is produced mainly in smooth endoplasmic reticulum and the inner mitochondrial membrane. These are the subcellular location in which phospholipids are basically produced. So phospholipids are the predominant lipid of the cell membrane, which has got hydrophilic heads, which will be protruding outwards facing the extracellular and intracellular aqueous medium, and the hydrophobic tail, which is mainly constituted of fatty acids. So how are phospholipids and glycolipids classified? So phospholipids can be classified into glycerophospholipids and sphingolipids. Glycolipids can be classified basically into sphingolipids. Glycerophospholipids will have two fatty acids along with one phosphoric acid attached to the glycerol backbone, and this phosphoric acid will be attached to an alcohol. Sphingolipids will contain a sphingosine as the backbone to which one fatty acid and one phosphorylated colon will be attached in simple sphingolipid. Sometimes it can be attached with a oligosaccharide instead of a phosphorylated colon or. So what is the location of phospholipids? Cell membrane phospholipid, which is membrane bound, and there are non-membrane phospholipids also. So cell membrane phospholipids constitutes the predominant lipid of cell membrane. So phospholipids is a predominant lipid of cell membrane, and it has got hydrophobic portion, which is associated with the non-polar portion of the membrane constituents, which includes glycolipids, protein, and cholesterol. There is a hydrophilic head of phospholipid, which extends outward facing the intracellular cytoplasmic aqueous environment as well as extracellular aqueous environment. Non-membrane phospholipids are forming the component of lung surfactant, and they're also the essential components of bile, thereby helps or plays a role in solubilizing the cholesterol. So what are the functions of membrane-bound phospholipids? Structural, it can be a predominant component of cell membrane, or anchoring. It will be attaching some proteins to the membrane. Signaling property, it will be a source of phosphatidylinositol triphosphate, phosphatidylinositol, as well as diacylglycerol. And it also serves as a component of myelin sheath, thereby providing insulation to the neurons and also speeding up the transmission of nerve impulse. Non-membrane bound phospholipids, they act as lung surfactants, which plays a role in easy reinflation of alveoli by the air. And they are also components of bile, thereby helping in solubilizing the cholesterol, preventing gallstones, and emulsifying lipids to help in lipid digestion. Sometimes they also act as a bioactive molecule, which includes platelet activating factor. And sometimes they also have a structural role by acting as a coat of lipoproteins. What are the important glycerophospholipids? It includes phosphatidylcholine, which is also known as lecithin, phosphatidylinositol, platelet activating factor. So types of glycerophospholipids are phosphatidylcholine, which is also called as lecithin, which is present in membrane, plasma membrane, bile, and they also form component of cell membrane. They decrease surface tension of aqueous layer of lung by acting as a surfactant. They also have a detergent property by solubilizing cholesterol and bile, thereby preventing gallstones. And lecithin cholesterol acetyltransferase is an enzyme which contains phosphatidylcholine, which esterifies cholesterol and HDL lipoprotein. Next is phosphatidylethanolamine, which is also called cephalin, which is present in brain lipid. Third is phosphatidylserine, which plays a role in apoptosis. Fourth is phosphatidylinositol, which acts as a precursor of second messengers. Phosphatidylglycerol is the fifth one. And sixth is cardiolipin, which is present in mitochondrial membrane. So phosphatidylinositol. It is a protein anchoring to plasma membranes, and it is also a reservoir of phosphatidylinositol is a protein anchoring to plasma membrane, and it also acts as a reservoir of arachidonic acid in plasma membrane. So this arachidonic acid is the precursor of prostaglandins, and it helps in transmitting signal across the membrane via production of second messengers, especially inositol 1,4,5 triphosphate and diacylglycerol. Phosphatidylinositol has got protein anchoring function also. It anchors proteins to membrane via carbohydrate phosphatidylinositol bridge. Example, alkaline phosphatase. It is anchored to the surface of small intestine, and acetylcholinesterase, which is anchored to presynaptic membranes. These proteins can be cleaved from their attachment by phospholipase C. What is the role of phosphatidylinositol in signal transduction is phosphatidylinositol bound to membranes is phosphorylated to phosphatidylinositol 4,5 bisphosphate, which will be degraded by phospholipase C to inositol 1,4,5 triphosphate and diacylglycerol. Phospholipase C is actually activated by protein G as a result of binding of any hormone to its receptor on the cell membrane. So any binding of steroid hormone or some other hormone to its receptor on the cell membrane will activate G protein, alpha subunit of G protein, which in turn will activate phospholipase C. So this phospholipase C is a phospholipase enzyme which will degrade phosphatidylinositol phosphate to inositol 1,4,5 triphosphate and diacylglycerol, which in turn will act as the second messenger. Next is phosphatidylcholine, which is actually very more important in the liver. So the liver will export significant amounts of phosphatidylcholine in the bile, and it also is a component of lipoproteins in blood. Role of phosphatidylcholine in lung surfactant. So dipalmitoyl phosphatidylcholine or dipalmitoyl lecithin. This will be synthesized by the pneumocystes. These are the cells which are lining the respiratory epithelium. And it is a major lipid component of lung surfactant. So it reduces the pressure needed to reinflate the alveoli, thereby preventing alveolar collapse. What is respiratory distress syndrome? It is very common in preterm infants where there will be insufficient production or secretion of surfactant leading to neonatal death. So the ratio of lecithin sphingomyelin ratio will be assessed antenatally in amniotic fluid. And if it is more than 2, it is an evidence of lung maturity in the baby. And it reflects the major shift of sphingomyelin production in the lung to dipalmitoyl phosphatidylcholine synthesis in pneumocystes, which is usually happening at around 32 weeks of gestation. So if the baby is, the delivery is happening and the baby is considered to be still immature and less than 32 weeks of gestation, we can go for lung maturation acceleration by administering glucocorticoids to the mother before delivery, at least 24 hours before delivery. So RDS, if it happens in the baby, it can be treated or prevented by intratracheal installation of surfactant. So RDS can also happen in adults when the pneumocystes are damaged by infection, trauma, immunosuppressants, or chemotherapeutic drugs. Platelet activating factor. It is one of the glycerophospholipid which plays a mediating role in acute inflammatory response as well as hypersensitivity reactions, and it stimulates platelet aggregation. It also causes neutrophils and alveolar macrophages to generate superoxide radicals as an antibacterial defense mechanism. Next is cardiolipin, which is diphosphatidyl which is an important component of inner mitochondrial membrane. It has got antigenic importance. It is recognized by some antibodies against Treponema pallidum bacteria causing syphilis, and it will lead to sometimes called APLE. Degradation of phosphoglycerides. Phospholipases are the lipolytic enzymes that hydrolyze phospholipid substrates at specific ester bonds into fatty acids and other lipophilic substances. Phospholipase A can be categorized or subclassified into A1 and A2. So A1 will cleave acyl chain, SN1 acyl chain, and A2 will cleave SN2 acyl chain, releasing arachidonic acid. Phospholipase B will cleave both acyl chains, and this enzyme is also known as lysophospholipase. Phospholipase 3 will cleave before the phosphate, releasing diacylglycerol and a phosphate containing head group. Phospholipase C plays a role in signal transduction, releasing the second messenger inositol triphosphate. Phospholipase D will cleave after the phosphate, releasing phosphatidic acid and an alcohol. So type C and D are considered phosphodiesterase. Phospholipase A it acts on the intact lecithin molecule and hydrolyzes the fatty acid esterified to the second carbon atom. So the resulting products are lysolecithin and the fatty acid. Phospholipase A2 is an enzyme present in the venom of bees and viper snakes and is also present in pancreatic juice, which has got anticoagulant properties. So phospholipases are lipolytic enzymes that hydrolyze phospholipid substrates at specific ester bonds into fatty acids and other lipophilic substances. So phospholipase A2 is also an enzyme which is present in venom of bees and viper snakes, which has got anticoagulant property. What are the functions of these phospholipases? They help in degradation of phospholipids, thereby producing second messengers, digestion of phospholipids by pancreatic juice, and sometimes pathogenic bacteria will degrade the phospholipids of membranes, thereby helping in spreading of infection. They also remodel phospholipases. So specific phospholipases remove the fatty acid from phospholipid, and there will be replacement of fatty acid by an alternate fatty acid, like binding of 2-palmitic acid and diphosphatidylcholine, binding of arachidonic acid to carbon 2 of phosphatidylinositol or phosphatidylcholine. So sphingomyelin is a major lipid present in nerve tissue membranes. They predominantly contain longer chain fatty acids such as ignoceric acid and nervonic acid. It is a layered membranous structure that insulates and protects neuronal fibers of CNS. Sphingomyelin of the gray matter of the brain contains primarily stearic acid. What is a myelin sheath? It is a myelin sheath which is composed of sphingomyelin, which insulates the nerve axon to avoid signal leakage and greatly speeds up the transmission of nerve impulses along the axons. How are sphingomyelins degraded are by means of an enzyme called lysosomal enzyme called sphingomyelinase. So sphingomyelin will be acted upon or degraded by sphingomyelinase to ceramide, which will be degraded by ceramidase to sphingosine and fatty acid. Niemann-Pick disease. We have two types, type A and type B. It is an autosomal recessive disorder where there will be deficiency of sphingomyelin, resulting in inability to degrade sphingomyelin. So type A is a severe form and an infantile form. So lipid will be deposited in liver and spleen, and they will lead to hepatosplenomegaly. And there will be progressive neurodegeneration due to deposition of sphingomyelin in the central nervous system. So these babies die in early childhood. Type B Niemann-Pick disease is less severe and there will be no damage or little damage to the neural tissue, but spleen, liver, lung, and bone marrow will be affected and there will be death in early adulthood. So with this, our lipid chemistry class is over. I hope you all understood. So if there are any questions, please let me know. And thank you for patient listening.